You've had a laminectomy. How many years ago did that happen?
That was November 18.
18. Okay, and so for just people that don't know, the laminectomy, they remove the back side of the, so they remove the spinous. And was it L5 and L4 or just L5?
I think it was L4, L5.
So just this part here, and the spinous, they take the sort of back wall out, and so it allows the spinal cord to not, in theory, it can now not get pinched anymore. If there's a disc herniation, then the spinal cord can actually move away from the disc. My main contention is that the laminas are holding weight, and that's their purpose. And then obviously muscles are attaching onto the spinuses, and so now another area has to take up a little bit extra burden. So we're going to leave that area alone. Go ahead and let me look at your posture. Look at your posture today. Yeah, okay. Left shoulder's a little bit high. You see your hips. All right. Right hip's high a little bit. Stay right there. Okay. Not too bad. About an inch for a musician. I know you're playing guitar a lot, right?
Yeah, guitar a lot and a lot of music production, so a lot of time on the computer. And
we don't get to spend a lot of time arching back or painting ceilings or
no.
Most of our life is forward, and so we're going to get you loosened up.
Yeah, so a lot of position like this. So, and I try to adjust. Sometimes I'll put the guitar over here, sometimes I put it over here to try to get some variance.
Yeah, have your back for me.
Okay.
All right, bend both your knees for me. There we go. Take one deep breath in, and then exhale for me. Continue exhaling. Don't stop exhaling. There we go. Nice. Breathe in deep. Exhale. Let it all go. Good. Breathe in deep. Exhale. Nice. There we go. Good. Keep that back arch. So don't let anybody obviously ever touch lower back and adjust your lower back.
Right.
We're going to leave that alone. We're just going to try to very gently loosen up this SI joint.
Okay.
Now take one deep breath in for me. I got you. Exhale. I got you. Going real gentle. There we go. Good. So how's that for me? Keep that lower back arched. There we go. There's no benefit to loosening L5. We're going to try to just move the guys around it a little bit. Breathe in deep. Exhale. Good. Let's go face that for me. Very good.
Dr. Bowe had mentioned something about my left foot kind of being out like this.
Yes.
Quite a bit.
So we have a couple dominoes going on with that. So when the foot goes out, that puts more stress on the medial meniscus. So the medial meniscus gets worn out faster when there's foot flare. The arch in your foot drops a little bit. But the main thing is what's causing the foot to flare is the piriformis contraction. So there's muscles in your glute that externally rotate your hip.
Mm-hmm.
Why is the muscles in my glute contracted? Well, because the nerves that they operated on, you're saying in the lower back, are what control the glute. So the goal was to relieve nerve pressure in the lower back. The nerve pressure in the lower back causes the muscle contraction. So what you're seeing is some level of latent muscle contraction in the glute, which is, Ed, why is my left foot turn out? Well, it's because there's that contraction in the glute. The only way to relieve that is to stop the tasering of the muscle, right? The nerve in the lower back tasers the muscle. Ultimately, the lower back reason why they, what was the diagnosis they gave you? Did they say disc herniation or disc bulge? Did you remember before they did the surgery?
Well, it was a schwannoma.
Okay.
Around L4, L5, so it was a large tumor in the spinal cord.
That's right.
And so they had to remove the back to, I guess, get to the tumor and remove it.
Did they give any reason for, why that formed there? No. I know you had that trauma in the car we want to talk about.
Yeah, in 2006, I was in a terrible car accident where I was in the passenger seat, and the driver overcorrected to on the highway I-4 going east towards Daytona. So it was about 60, 70 miles per hour. He, I think, merged to the left lane, saw a car coming, and then went right, overcorrected, spun off the road, and the right side of the car ended up hitting like a concrete pole.
Right.
So I was in the passenger seat, and so my whole body and head and everything just shifted this way, hit the side of the car. And I was hospitalized for about 3 months
Jeez.
from that, and had an ileostomy for a year, my senior year of high school,
Yes.
and many surgeries, and they did the reversal on that, so
Right.
I don't have the bag anymore. But that was quite a traumatic year.
Right.
So
I mean, I would think it's somewhat associated with that trauma. You know, the whole trauma to your abdomen. I'm not sure if they gave you an explanation for why a tumor formed in there. But the drain lines can be affected. The lymphatic flow, because you have a trauma. The body's not able to clean itself internally. Then a little pocket forms and it ends up being next to your spinal cord, and so now we got to remove it.
I had about I think 3 abdominal surgeries. So I have a roadmap on the front and the back.
All right. Well, gosh.
So maybe some of that influenced the schwannoma, or
Right.
I think there's a lot of evidence lacking on the origin of
Right.
where that comes from. Some say it's hereditary. I found out a cousin had one in my family on my mom's side.
Schwann cells are the nerves, right? That's the actual nerve cells are called Schwann cells. So Schwann and then oma means tumor, so it's translates like nerve tumor. So you have something's, either the nerve is so inflamed, and in some people it becomes clogged, or becomes a cyst, and then it becomes a tumor, and I don't know if we really fully understand why some people get that and some people just it doesn't form. Okay, let me go really easy. I got you. There we go. Just there we go. I got you. There we go. Okay, we're gonna loosen this up a little bit. There we go. Just trying to loosen up this upper neck a little bit. There we go. I know you did like a concert yesterday, right? It was online concert, and when you're playing and you're having to be forwardly rotated, all these muscles have to work really hard, and it's not like you're mid-concert. Hello, everybody. I'd like to take a break for about 10 minutes to give my spine a stretch.
We can all rest our spines. For
Right.
10 minutes.
It's not happening, Ed. So I call that, you can use your spine, but it's when we go into abuse, when your body's trying to tell you to stop and we have to continue going. That's when our body starts to adapt to those things and create spasms, trigger points, and then lock things down. And there we go. Okay, this left side's a little tighter over here.
What would you say is the longest for anyone to sit at like a computer if they were doing computer work? If they could take a break, if they had the freedom to go, computer on, computer off.
Right.
How long would you say?
It sort of depends on the age of the person. When we're younger, we're allowed to sit longer. Our spine is more, has more water in it, and then as we tend to age, our spine sort of dries up a little bit more, and so we have to do more to keep our spine lubricated, like an oil kind of idea. So when you're, I think of that like when you're 18, you can sit for 12 hours. When you're 28, you can sit for 10. When you're 38, you can sit for 8. Every decade you lose like 2 hours. That's like your daily allowance, let's call it, right? And so when you're younger, you have a high allowance. Like I used to sit for 14 hours and I had no problems, right? Because you had a high allowance, and now that you're 40, it's like your allowance is now 8 hours, or and so you drive to work, you sit for 8 hours, you go to dinner, watch a movie. You're already at 10, 12 hours. You're 4 hours in debt now, right? So it's I know I demonize sitting, but it's really about balance. It's the over and abundance of it that causes problems. Your posture is a compilation of whatever position you're in for the most amount of time. So if we spend a predominant amount of time forwardly rotated and we stay in that position, especially if it's more than 20 minutes at one time, you're essentially stretching your body forward. And every successive time that you spend more than 20 minutes in a position, you have two brains, right? You have your cerebrum and your cerebellum, and your cerebellum is this little tiny brain in the back, and that cerebellum actually has the what we call proprioceptors, all the position sensors in your body, talk to your cerebellum. It's where your blueprint for your body exists. And so when you stretch for 20 minutes, the sensors in the joints essentially start changing the blueprint for where you believe center is. And that's why when I'm checking your posture, essentially I'm accessing that cerebellum, right? I'm asking you to show me where center is. That makes sense? And so this you're showing me where you think center is, and it's not where center should be. Right? Because you've modified it. You've changed the sensors, or the sensors have actually changed the blueprint. And now in order to undo it, we have to, what we call mirror image stretch you, right? Take you to the opposite extreme. And that starts, again, modifying the cerebellum, modifies the blueprint in your brain for where you believe center is. And this is how I believe posture is the only effective way to change posture is by changing the cerebellum blueprint, essentially. We have a lot of people teaching that we need to work on muscle strength, and even though that might perhaps work for a period of time, I don't believe it can really work for a long period of time, because eventually muscles get tired, they get fatigued, and then you round back forward. So I remember watching something years ago. It was like a news show where they had a bunch of news anchors, and some story was like, here are the top 3 conservative treatments for back pain. And it started off with, like, say, massage and acupuncture, and then it said number 1 conservative treatment. And they all looked around, they said, chiropractic? They were like all befuddled, and they were like, what? Chiropractic is the number 1 treatment for back pain? And then they said, chiropractors are saying that the number 1 reason for back pain is posture, right? And so the minute they're all sitting on these little stools, and the minute they said posture, all 3 of them immediately, oh yes. And the one elderly guy was like, posture is very important. I know all about posture. Let me tell you about how posture is important. And then he, tried to speak intelligently about posture. And then within about 3 minutes, if you fast forward, you see him, go right back to slouch forward. It's like, you can only stay conscious of your posture for so long. You do your best, but I believe you have to counter stretch. So I got you. I'm gonna go real gentle. Let me go. I got you. Let it go right here. I got you. There you go. I know. What in the world was that, Ed? I got you. I think we got all these. I'm just checking. I'm a greedy chiropractor. I got you. There we go. Little piece. Here we go. There we go. Much better. So this is the arch. We just gotta get your neck more and more used to this position. I know you went through a lot of all those surgeries and traumas. Maybe if we had worked on your spine and somebody was digging around and just cleaning the area, who knows? It's hard to say either way. There's no double-blind studies for, one person gets worked on after a trauma, another. Does that make sense? But I would say that let your chin go down a little bit. That the more you can work on the spine, the less likely things get congested. I know that the movement of the spine is what keeps everything flowing. Most likely after a trauma, your body tries to guard. Does that make sense? Stiffen everything up.
Right.
Especially something that rough, your body probably, locked everything down. It said at any moment he might get into another car accident.
Right.
So your body doesn't really believe. Your body doesn't believe that another trauma is not going to happen.
Yeah, and within that year afterward, I wasn't very active, because I couldn't be, with the whole ileostomy and everything, and so that's even more reason for everything to just be frozen.
Right. Yeah, mainly all just in your shoulders here. This is the neck. Neck is the movement of the vertebrae actually keeps it clean, right? So you're not going to really see much gua sha mark when the bones are moving properly. We usually see it more in the areas of restriction. These are the attachments, so the roots of your neck attach here, and these marks are pretty dark, more, blackish instead of red, which tells me it's sort of older blood, older, stuff that's been stagnant for a while. And so we'll get that cleaned out. There we go. This side's a little bit higher. I got you though. So the right side, I got you. Relax your shoulder.
Yeah.
So that's what I mean by guarding.
Yeah.
Like, no, he's gonna go over there, and I'm not sure if I'm gonna be right there. Yeah.
Yeah.
You're right-handed.
Yes.
Yeah. So this right side is You might be able to see it from over there. It's a little bit higher. You know, it's tighter over here.
Yeah, and my right arm and elbow and hand and everything is
Right.
probably higher than my left most of the time.
While you're playing.
Yeah, it has to hug the guitar.
Right, so sustained isometric contractions, right? So the muscle is not changing in length, but you have to contract the muscle for a long period of time, and then if the muscle says, hey, would you mind taking a break? You have to say, sorry, muscle. Not able to do that. Yeah, right there is where we're going to spend some extra time right now, right here. This is, I feel like the left side feels really good. And then I came over here and
Yeah, we don't we don't learn much about health in a music degree.
right.
We're not taught much about how to take care of our bodies as it relates to our study. And it's physically taxing because we are encouraged to practice and practice and practice so many hours a day, but
no guidance.
no guidance on how to counter so many hours in one position.
Kind of reminds me of, chiropractors in chiropractic college. They get all the knowledge, but they have very poor business training, and so we graduate as chiropractors and oh wait,
Then what do you do?
I don't know how to run a business,
Uh-huh.
right? And so, it's like I'm a musician. I can play these instruments perfectly, but my back's killing me now.
Yep.
What do I do?
And likewise, what do you do in business as a musician?
Yeah, because this right shoulder is lifted up. Essentially, you're tilting to the left, and that expands the right side, opens up these areas. The joints are loaded with pain fibers, and so when you start compressing them, then you start feeling them. The left side's already compressed all the time, so the door's already closed on the left. And so when I ask it to close, the door's like, yeah, I'm used to closing. The right side's, the drawers are all open, and the distance from where it's, from full closure and where you want to be which is what we try to use the word subluxation to talk about. That was the word chiropractors were trying to say. The bone is out of its normal position. It's subluxated. It's less than a dislocation. There we go.
Yeah, so when I lay down at night, my body just all of a sudden just relaxes. It calms down, and it's almost, I feel like my body says, thank you for laying down.
Right.
And I feel like if I can, probably should do that more throughout the day.
Right, postural contractions, right? So your alignment is causing, work. Your muscles are working because now being upright, there should be a little bit of work when you're moving, but that makes sense. When you go to a neutral position standing, there shouldn't be very much contraction in your back at all. Does that make sense? When you bend forward to put something in the dishwasher, your back muscles contract, to keep you from falling over, right? Now, if you're partially rounded forward, there's a partial contraction all the time, and then when you lay down, that contraction is able to, relax, and your body's like, oh, thank the Lord, he stopped.
Yeah.
Oh my.
Yeah.
We were telling him for a long time to lay down, and we
all
thought
day.
he was never going to listen. Right. So your foot is in pronation all the time. Even as a result of this surgery, your foot, so if you look at the difference between his left and right foot, there's more arch over here on your right foot, and you see how this is all popped out right here? It's like you're in constant pronation, and because of that constant pronation, your foot desires to externally rotate. That's why your foot flare is happening. And then what I ultimately care about is this medial meniscus. Is there any symptoms here in that would be the...
No.
This is the meniscus in your knee is very similar to the discs in the spine. They don't regenerate. They're like a cartilage. Does that make sense? And so there's a wear or a certain amount of miles that you're going to get on it. Having your foot flaring, the ankle, I don't see any long term. The issues are that this is going to wear this out at an accelerated rate, And so why you need to try to keep working on your, and part of this is now is we actually need to work on trying to get that supination. So this is supinating is, it's like this, you're turning in, right?
Yeah.
This is
It's
pronating.
Very resistant.
Right.
There.
This is supination, like you're asking for a bowl of soup. So we call it supination,
Okay.
and then pronation is, so he's in constant pronation here. Let me see how loose these joints are here. I got you. Yeah. This toe is. I got you. Okay, I got you. I'm just checking them. A lot of stress on that second toe. So this toe is actually adapted to having all the stress on it, right? So
Okay.
there shouldn't be so much stress. That's why the toe's starting to hammer a little bit.
Uh-huh.
That's why the joint's just inflamed in here, but that's ultimately happening because you have very little arch on this left foot,
Mhm.
and I got you. Pain when I do that?
No.
Okay, I got you. Okay, all right. You okay?
Uh-huh.
Hold on to the table for me a little bit. I'm gonna go real gentle. I got you. All right. A lot of discomfort, a little bit.
No, just on the skin.
Just skin. Okay.
Yeah.
Not the joint. Okay. All right. It's probably pretty locked down in there.
I
So
think should I be more careful with the types of shoes I wear? Because I've always worn flip flops my whole life.
I think that's fine. I don't use, it's going to be uncomfortable to have a lot of arch support in there because it's the opposite of what your foot wants.
Right.
So you're going to sort of, to me, have a natural inclination to go to a flip flop that doesn't have a lot of high arch in there, even though you might need to be trying to push that a little bit. You want to try to find one that has a little bit more arch support and might take you into supination a little bit more than letting you just do what you want to do, which is feed that monster, which is continuing to pronate, continuing to externally rotate. That makes sense. That's all part of the same complex of feeding that. The external rotation and the pronation are the same kind of avoidance, of an injury essentially from whatever happened before the surgery, and then as a result of going in there and working on it, now the body's saying, "Oh, I don't want to go over there anymore." And that's what your foot's essentially in avoidance. It's trying to get away from. It's trying to put the stress somewhere else. There we go. A little bit more back. You gotta just, even just laying face down on my table, does that make sense? It holds you more upright. And so because you were down for, an hour, now your body's more upright.
Mm-hmm.
And now when you go home, you counter stretch, lay back on your back, spend some more time, and then that'll take, like you're saying, when you lay down, my back is able to relax. Just being more upright, the tension in your back will become less. Like, go ahead and lean forward a little bit. Lean forward. See how that gets all tight in here?
Mm-hmm.
It gets tighter in your back, and then as you come upright, everything can now get softer.
Mm-hmm.
Feel that?
Mm-hmm.
So the tension in your back is ultimately coming from your posture, and then, I have to do my concerts, I gotta do my work. So at the end of the day, you have to go back to counter stretch this front part, your sternum, all the ribs that attach here on the front. That's what's always been rounded forward and sort of everything's been bound together. We have to allow that to open up,
Right.
stretch those joints.
Mm-hmm.
You're gonna press your elbow back into my elbow. So there we go, just relax now. Keep pressing. There we go, good. Okay.
It's like Superman.
I got you, press back. There we go.
Wow.
That was a good one.
Woo.
I got you.
Okay.
Just go ahead and tilt your head to the left a little bit for me. Tilt your head left. I got you. I gotta get a little more grip on you, sorry. I got you. Tilt your head left for me a little bit. I got you. All right, good. And just relax. Okay.
I like watching the thought process, like.
Yeah. Like, what's going on?
You gonna take my ear off? I got you. I gotta get a good grip on that. There we go. Okay. Go ahead and tilt your head to the right. Tilt your head right a little bit. Okay, good. Okay. Good.
Ooh, okay.